Along the lines of this process, I'm curious if you were to address the most common misconceptions about obtaining your card, what would they be and how would you address somebody who might have heard it works this way or another?
Sure. These are common points that comes up. That what's the most difficult part of this process more than anything else, and what are some of the misconceptions? I think the number one misconception with regard to medical marijuana is that patients who use it will have a psychoactive effect, or they will get stoned or be high. This is not true. With the way medical cannabis is nowadays, we're able to have significant control over the psychoactive components of medical marijuana. So I would say probably the number one misconception is if I use medical marijuana, that I will be stoned, and that's not true. I think another misconception is that I wouldn't qualify for medical marijuana, or medical marijuana might not be good for me. I think there's many disease processes or entities or symptomatologies that potentially haven't classically been associated with medical marijuana being effective, but yet that we have found this is very much so. I think PTSD is a fantastic example. So I think those are the two biggest misconceptions that I run across on a daily basis.
And what about misconceptions just about the industry in general? It's a new field, I would say, for a lot of folks, especially, of course, the state of Pennsylvania. So anything about the industry that you hear buzz about that, might not be correct information?
Sure. I think it's one of the biggest, when you're talking about one of the biggest misconceptions or some of the confusion in the industry, oftentimes nowadays, particularly what you see is with regard to people talking about CBD, and you're talking about CBD derived from marijuana or potentially CBD derived from hemp, and that it's a point of significant confusion for many patients. I think really how I like to explain to people is to look at as hemp as almost being a separate entity in and of its own. So oftentimes when patients nowadays, for example, at CCC, or could it be at a local apothecary, whenever you see cannabis oil or CBD oil being sold, typically that is related to the hemp plant, right, or which is essentially a species of marijuana, but is very low in THC. Conversely, the other side of the fence is the products that are being obtained from the dispensary, for which you need an actual certification, a medical marijuana certification. These are what we would call full-spectrum cannabinoid products, so that not only do they contain CBD, but also potentially THC, the psychoactive component, and some of the other cannabinoids as well. So I think that's one of the points of confusion that I see most often in patients. I also think one of the big things is that people don't know, with it being such a new and upcoming field, patients are unsure of where to go for reliable information and research. And this can be somewhat daunting with the internet and all the resources that are available at your fingertips. So I often caution my patients, just make sure that the information that you're getting is accurate and reliable.
I think you started to touch on a really good point. Sometimes hemp, CBD, THC, and any other abbreviation all gets lumped in as one category. Can you pick that apart a little bit and explain the difference between all three and specifically what pertains to you and what you do at CCC?
Absolutely. So when you talk about the species of cannabis or the marijuana or the hemp plant, largely some of the active ingredients are what we call cannabinoids. And we often hear people talking about these. The most common one that everybody knows is THC, CBD, or cannabidiol is another one. And what these are is that these are the chemicals, or what I would call largely the physiologically active chemicals in the marijuana plant or in that species. Now, our body is set up that we have endogenously what's called an endocannabinoid system. So these chemicals, these cannabinoids like THC or CBD, what they do is they act on these receptors within our own body. And then by acting on or around these receptors, it can promote a physiological response. Now, what we're starting to find out in medicine is that each of these different cannabinoids has its own different physiological properties. So, for example, we know CBD or cannabidiol that it's a very good anti-inflammatory. We know that it's an anxiolytic and can help reduce anxiety. Conversely, THC, we know that it can be very good as an analgesic, and it can be good for an appetite stimulant. CBG may have anti-parasitic or antimicrobial properties. So each of these different cannabinoids can have their own different physiological response. One of the big things that you see in cannabis and with these cannabinoids is that THC is really the only one that has significant psychoactive properties. So that feeling of feeling like you're stoned or high, as people might describe it, is oftentimes or is mainly attributed to the THC components that is contained in cannabis. However, this isn't just a bad thing, and it can be THC is a very good molecule, and it can have a whole bunch of therapeutic or beneficial effects. So I think really whenever for people to understand when you're talking about hemp or you're talking about marijuana, really what you're talking about are those cannabinoids or the active ingredients in those. And with medical cannabis, we can control those somewhat. So typically whenever you would come to a place like compassionate certification centers, for example, our products that we sell are derived from hemp and they are CBD only, meaning that really those largely would just contain the cannabidiol versus having a medical marijuana card and going to the dispensary where those medications would have more of a full or broad spectrum cannabis profile, meaning that they would have multiple of those cannabinoids in them. Different patients respond to different cannabinoid profiles, so this isn't a one-shoe-fits-all. But as a general saying that I like to speak with my patients about, oftentimes hemp-derived CBD therapy can be a very nice way and a very gentle way for people to introduce themselves to medical cannabis therapy.
And with that being said, though, too, I think that was a great definition of the differentiation points. But then talk to me a little bit about how medical marijuana's impact on the opioid epidemic. Obviously, two completely different fields of medicine, but how do you think medical marijuana is helping those get off their opioids and that addiction?
Sure, and this is a hot topic now, Jenna, when you're talking about the opiate epidemic and in our country, what are we going to do to fix this problem? And what we started to see is that medical cannabis may potentially play a very, very big role in this. Pennsylvania was actually the first state, I believe, to have opioid addiction or substitution therapy added as a qualifying condition. And really what this means is that we're able to use medical marijuana to help treat opiate addiction, both in the acute and in the chronic or long-term sense as well. Cannabis has shown tremendous promise with regard to the opioid epidemic and actually being a definitive therapy. It can work in a few ways. The first way that the cannabis can do is it can help soften or lighten the symptoms of acute opiate withdrawal. So things such as increased heart rate, anxiety, nausea, diarrhea, anxiousness. Cannabis can really help to alleviate those type of symptoms and help patients deal with the acute withdrawals. What we're also seeing on a more long-term standpoint or more chronically, from a psychological standpoint, that cannabis is showing promise and being effective of helping reduce people's urge or from going back towards those opiates. And then the third thing is that many patients have been on opiates because they were started on an opiate because of a pain-related complaint. So what cannabis is able to do is not only is it able to substitute in the opiates or help treat the withdrawal, but it also can provide an alternative treatment for the chronic pain. So when you look at it, cannabis really can provide a slew of different potential positive outcomes or benefits with regard to opioid withdrawal and on multiple different levels. So it could be an ideal treatment plan, and I personally believe that it's going to be one of the most critical elements or tools that we have as providers to help stop the opioid epidemic in our country.
And that's really powerful. And I think that kind of segues nicely into the next portion I want to discuss. Without being too specific, because I understand HIPAA and things like that, but I want to hear about some patient success stories. I don't know if you have any case studies and specifics you can maybe reference that way, but I want to hear who's been working with you guys and really had made some strides, either by being weaned off some opioids or perhaps they just overall feel better, some patient testimonials, if you will.
Absolutely. I think from a patient testimonial standpoint, it's sort of where do we begin more than anything else. So the first two specifics I can give are with regard to the opiate epidemic and sort of as a piggyback. So probably about 3 weeks ago, I had two patients back to back. The first was a younger gentleman. He was in his early 30s and he had been addicted to heroin and he had been on Suboxone for about 5 to 6 years, I think. He was completely naive to cannabis, had never used marijuana before. He came to see us and he was certified and came back to see us 6 months later. And at that time, he was completely off of the Suboxone. He had been able to wean himself off, was only using cannabis, and had told me, he felt the best that he had in about 10 years. The patient that was right after him, as irony may have it, was a gentleman in his late 50s. About 20, 25 years ago, he had a severe work-related injury with his back that had required multiple surgeries. When the patient came to see us initially, I think it was January or February, he was on some really high-dose opiates, extended relief morphine, Percocet for breakthrough pain, and again, another patient completely naive to medical marijuana or cannabis in general. We saw the patient about 8 to 9 months later, and the patient was completely off every single opiate that he had been taking and using only cannabis to control his pain, and reported again that I remember this gentleman telling me that he felt like he got his life back. And that was really attributed to medical marijuana. I can tell you numerous other treatment success stories, whether it's from patients who have had migraines and been suffering and couldn't find relief, to young children, whether they be suffering from epilepsy or recurrent seizures and having dramatic or profound seizure reduction, to autistic children that are able to now function better and communicate. So really the success stories, there's so many that I wouldn't even know where to start or where to stop. And I can tell you this, that as the days go by, we have more and more success stories. And it's overwhelmingly success stories, and very ever are there failures, I would say.
And the 800 number to contact somebody at Compassionate Certification Centers?
888-316-9085.
About the children, because I do believe that is very, very powerful. And for any, parents who may be listening, it may be a difficult discussion to go into, a pediatrician and say that you want to take this route. So talk a little bit about how, if you're not getting a medicinal marijuana card for yourself, perhaps if you are a parent, how, if at all, may that be different if you're getting it for a young child?
When you talk about what steps should I take, particularly whenever you're talking about pediatric or patients or children, who do I talk to? There can absolutely be some sensitivities to that. I think the first thing that I tell parents and really patients is to remember this. The medical marijuana sort of movement in our country is different than what has been done in the past, and it's really a paradigm shift. Typically or traditionally in medicine, the changes would be brought forth from people like myself, doctors, researchers, healthcare institutions, right? And that they come this way and then they're pushed towards the patient. Cannabis is different. Cannabis movement really is a patient-centered movement. And the reason that we are where we are today is because of patients taking it in their own hands, and in lots of cases, parents looking for better treatments for their loved ones, their children, or their family members. It's a profoundly powerful thing, and that's really what's got us to where we are in cannabis today. And on a more scientific note, I think one of the very gentle and easy ways that parents and with regard to children can open the discussion of medical cannabis therapy is really to start with CBD, or in particular hemp-derived CBD. We know that is, at this point with the recent Farm Bill or the Farm Act, the change of legislation, essentially hemp is legal on a national scale. It crosses state borders. We also know that it's a completely non-psychoactive component as well, which oftentimes will make parents feel better, and that in certain cases at times it can be a very effective treatment plan on its own. I really encourage patients, if they're not sure, that that's a very good starting point with regard to medical cannabis therapy, and then that can be built on from there.
All right, Dr. Doner, the last question I have for you would be your closing thoughts. And for anyone who's listening, whether they caught this program in the beginning, middle, or end, what's one takeaway that you want them to know about your company?
I would say that in a closing statement, the one thing I want people to know about Compassionate Certification Centers is that whatever your medical cannabis needs or questions, we're here to help and support. We are an organization that was designed to support patients and to support the state system, and really to promote the education and the expansion of medical marijuana. So that if you don't know where to go, our doors at Compassionate Certification Centers are always open for anybody. And I think that's the thought I would want to leave people with, that if you're not sure, ask. And I feel confident that our organization can help answer a lot of the questions that people may have.
Dr. Doner, thank you so much for your time today. And if you could, one last time, the 800 number to contact Compassionate Certification Centers.
888-316-9085.